but the things they have added to keep this food palatable for you, or the cheese that's going in the burger in the fast food chain, you're getting it there. There's only 20% cheese, 80% all chemicals inside, most likely. So you have no idea. You think it's a cheese, and that is going to cause the heart disease and contributing to cancer and obesity. It is messing up your microbiome in the stomach. If the microbiome in the stomach is not happy, it is going to contribute into less serotonin, less happy hormone in your brain, and you'll be feeling more sad, more depressed, and more addicted to those foods. So those foods are worse than smoking, in my opinion, because we think they are safe. We think we are feeding our kids the food. They are hungry, and look at these fries. Sometimes we buy those fries, the French fries,
Oh
or
yeah.
fried foods there. So look at the oil. They recycle the oil. Keep reheating it. Keep cooking in the same oil. It becomes dark black color like this sweatshirt I'm wearing it, and
Yeah.
people eat that oil every day.
And those are
What is it the
just
oil going to do in your body? It's
it's
going to
broken.
clog up your arteries.
And just so people know, when fat gets to that point, it becomes literally a poison. When it's that broken down, when it's that degraded. Man, I'm glad to hear you saying this. So we have this movement in America that a lot of people, obviously there's the issues with RFK and his perceived vaccine views. But we have this Make America Healthy Again thing, and they just some fast food places are moving to beef tallow from seed oils, whatever it is. I honestly see it as an overall positive, even if you don't agree with what RFK does, just simply people looking at food now, right? Like
Yes.
simply identifying that we have a problem in this country. We have an obesity problem. We have a problem with autism rates going through the roof. My thing is, okay, don't ban foods. That's un-American, right? America's like live and let live, but we need to have this data, and unfortunately the big food, the lobbying groups, they keep these things going. I'm sure it's the same in Canada. You get politicians got to get elected somehow. Someone's got to contribute to their campaign, and they're all sellouts. But we're in a situation now where I think America is more and more educated on the foods they're taking in. It's just a matter of them listening and taking in this information. Even if RFK is 10% right, again, what I say, if we improve by 10% in any measure. So looking at that, do you guys have anything similar in Canada where you have a movement towards more healthy? And obviously your ingredients are better than ours. We were doing RFK actually points to Canada. You take the same product and we have triple the ingredients as the same Canadian product. Is there a similar movement going on north of the border here?
Well, it is. It is. It's just because of being a public healthcare system,
Yeah.
Canadians end up living longer than Americans. So we have a longer lifespan in Canada, just
Yep.
because people have an access to primary healthcare services free of cost. Yes, taxpayers paying it. There is some delay to access services sometimes. There is some harm done because of that. But in the end, people can access the lab services. People can access the basic
Mm-hmm.
healthcare services, so they can make their life better. So, from a Health Canada perspective, we are working in food guide, and it talks about on a plate what kind of food we should be eating. We should have a grain. We should have a whole fruits and vegetables. How many times we should be having a day? What is a healthier weight? So there's a kind of food guide out there, so people can go and start to follow that. And there is a movement happening not from today. It's been happening for last few decades. It
That's
keeps
fantastic.
updating. It keeps changing based on the society becoming more multicultural. They're adding more multicultural foods to that. Obviously lobby groups are everywhere. They try to push their foods to be included in the food guide.
Yeah.
But it happens all the time. So but the awareness is there. We do have less chemicals as compared to American foods coming in, but when you compare to Europeans, we are not that good. So look at when you
Yeah.
go to Europe, they get a less chemicals in their food. The more thing they have to declare, GMO foods are banned there, and many things you can trust when the data coming in. But it's hard to trust the data what we see in Canada or in America sometimes. Yes, we have a good milk supply versus USA in Canada, and we have a very good fruits and vegetable supply coming in. We have a more disclosures there. We
Yeah.
understand it, and there's more awareness about it. We should be eating more local. So if you're transporting food from further far away and eating less local food, it essentially has been preserved with these chemicals, and those hyper processed foods comes in play. So the more local, more closely grown foods you can eat every day, the better it is for you and for the environment.
Yeah, I'm fortunate. I live in Tennessee. We got farms all over the place. I get my beef from I can literally go point out my cow, right? So it's a beautiful way to live. I agree with that. Is your going to Canada's food guide? So our food pyramid is upside down. We have ultra processed foods as like the number one source. Like, so is your food guide a bit better written than the food pyramid that we have here?
Yes. Yes. So we don't have a
You
pyramid.
can't be
We have
worse.
it's a good one. And my wife is a dietitian, so she will not agree 100% what has been written there, but it's pretty good. It's a pretty good start. It's very layman
Okay.
terms. And it simplifies things. It explains in a plate, like if you have a plate. So when you're putting a food, so it
Yeah.
divides and simplifies people understanding. Pyramid is very difficult to understand for anyone. But if you have a plate and you're just taking a circle and cutting a
Yeah.
circle into four different quadrants, and then putting food according to the quadrants, and then you know the type of serving you should be eating every day.
Where does poutine fit into that? Just kidding. You guys and your
Well,
poutine.
it's not a kind of food guide at all.
I've been to Canada so many times and I've never tried poutine. I just can't bring myself to do it. And I'm not really
Me
missing out.
neither.
I've never eaten at Biscuit Bill or Bojangles and I live in the South. So just,
Thank
no,
you. Don't
funny.
do that.
Yeah. Funny tip. Bojangles is the number one restaurant in Roatan, Honduras.
Wow.
I don't know how the hell that happened, but it did. That's fascinating. So you're married to a dietitian. What a beautiful marriage, right? You got the
Thank
guy
you.
who fixes the hearts, and you got the woman who prevents people from having the heart attacks. I love it. That's a match made in heaven. That is
Thank you.
awesome. That
Thank
that
you.
is
Thank you.
great, man. I'm really so moving on to well. Let's dive into something a bit controversial. And if you don't want to answer this, that's fine. So we're seeing there's people saying that both the virus, the COVID virus, and the vaccine are creating issues with the heart. And personally, I think there's so many factors out there. I'm not going to say anything's doing. I read the data. The data is hard to decipher because there's obviously with data, there's going to be some that go this way, some that go that way. In your opinion, and again, don't have to answer this, is COVID itself a factor in COVID, the actual virus? Did it increase the heart risks or the heart disease prevalency? And as a follow up, do you think the vaccine was net neutral or that it might have had on certain populations a negative effect on heart health?
Thank you for asking the question. Uh, I'll start with the facts. So I've been practicing cardiologist in Calgary, in Canada. So if your question is, Dr. Kapoor, did you see a lot of patients after COVID coming to you from more heart disease issues are happening linked with viruses or certain patient group? I did not.
Okay.
I have not seen a huge uptake of the patient or certain category of the patients that could be potentially linked to it. Okay, so I have not seen anything
Okay.
totally explosion of heart disease, explosion of heart failure, because we have four cardiac imaging centers in Alberta, two in Calgary, one in Edmonton, one is in Medicine Hat. We do so many ultrasounds a day, so many heart tests a day. We have not
Yeah.
seen the people coming in. Like we have to see to believe it, right? Because I have
Yeah.
not seen that. So secondly, yes, there was harm done to the patients. There were patients who got heart failure or myocarditis, some complication. Yes, it was done.